Welcome to the Diabetes at Camp segment of our online training. My name is Michaela, and I'm a registered dietitian and certified diabetes care and education specialist serving as the nutrition director for Camp Pendon. During this portion of the training, we will discuss essential information regarding the management of diabetes in a summer camp environment. Please feel free to take notes and revisit these videos as often as necessary to ensure you're comfortable with the material. We'll dive into these topics more during our town hall sessions and our in-person training. If you have any questions after reviewing any part of the training, do not hesitate to reach out to me, our medical director, Dr. Emily, or any of our experienced medical staff. Camp Pendon is a week-long summer program designed specifically for children with managing diabetes. Because of this, our summer sessions are staffed with a variety of clinical professionals, including registered dietitians, registered nurses, diabetes specialists, pharmacists, physicians, and nurse practitioners. Each den will have one or two designated medical staff members available to address specific questions related to the camper's immediate needs. While the medical staff primarily focuses on diabetes management, everyone, including our adult counselors and den leaders, play a unique role in supporting our campers and their diabetes care. We will discuss these specific roles as we go through training sessions. To briefly cover some of the things that you'll be responsible in your unique role and some of the other roles that we have at camp, take a look at the list here. Day to day, all staff are responsible for monitoring campers and helping to make sure blood sugar levels stay in a healthy range. Sometimes that's just about recognizing blood sugars as they change and letting someone know if you find anything concerning. Adult counselors, students, and interns have the biggest portion of this as you spend the most time directly with our campers. You're managing them, keeping on time to get to activities, getting them ready for breakfast or other meals, and it's important that you make sure that you're helping to manage the blood sugar checks, record everything, and let the med staff know if anything pops up. Because you spend so much time with the campers, you're also uniquely poised to be able to identify patterns and things that pop up throughout the day. Campers may not even be aware of these things themselves. We'll talk about some of the things that you can do to assess your campers throughout the day, but be sure to speak up if you notice patterns or issues, and if you happen to see anything that could indicate a high or low blood sugar. Our students and interns are also welcome to shadow and participate with some of the medical things we do at camp. There may be specific times that the dietetic interns are helping with prepping meals or snacks, or our nursing students are observing the pump team. Work as a team within your den to make sure that there's always someone with the campers to help manage diabetes. The den med staff are positioned in dens to be available for all of the medical needs that pop up and the insulin management portion of diabetes. They are the only ones allowed to dose insulin for meals, snacks, and corrections, and are there to help make decisions if blood sugar levels get too high or too low as needed. They're also available for the scrapes, bites, and bruises that do happen along the way. We also have several dietitians on staff this year. They're there to be the experts in carb counting and addressing nutrition issues like inadequate carbohydrate intake or food allergies. Note that carb counting is under the adult counselor, student, and intern portion as well. Everyone at camp can help our campers carb count, and we'll go through the tools to help you feel confident doing that. During this training, you'll go through 5 modules. You will learn what is diabetes and how we treat diabetes at camp. You'll also get an understanding of how these approaches differ because we are in a summer camp setting. You will also continue to explore your specific responsibility in caring for campers. We'll review the supplies and tools you will have available and provide an overview of the skills and procedures that you will then be able to practice during our in-person training. To get started, we want you to be familiar with several key words that we will use often when talking about diabetes. The first is glucose. This is the form sugar from food takes in your bloodstream, and it's eventually used as energy for the body. Think of it like gas in your car. Glucose and sugar are often used the same way and are interchangeable words when talking about diabetes in many ways. The sugar in our food turns into glucose, and we refer to that as blood sugar or even blood glucose. Next is carbohydrates. Carbohydrates are one component of the food that we eat, and it provides energy or calories. Carbohydrates can be broken down by the body and sent into the cells as the form of glucose to provide the energy that we need to do what we do. Carbohydrates are our body's favorite source of calorie and energy, and through the process of digestion, they break down into glucose. We will definitely talk about this more later in training. Insulin is a hormone that the body produces naturally in someone without diabetes, and its main role is to allow the body to successfully use the sugar or glucose that is needed for energy. You can think of insulin like the key that fits into a lock. The cells of our body and our muscles, organs, brain, etc. are the lock. When the body needs energy to move and do everything it does for life, insulin is released by the pancreas to go open the locks on the cells so that sugar can flow easily into them and out of the bloodstream. In type 1 diabetes, which is the type of diabetes we see at Camp Hendon, the body stops producing insulin. This means there is no key to unlock the door. Insulin then must be given as a medication to help someone with type 1 diabetes get the energy that they need from food. Glucagon is another hormone produced by the pancreas and works in an opposite way of insulin. The way insulin helps remove sugar from the bloodstream is similar to the way glucagon helps restock the bloodstream with sugar, especially during periods of low blood sugars or fasting when we're not eating. The pancreas is a small organ located just behind the stomach in the body, and it's responsible for producing the hormones that regulate some of the metabolism that our body does. Remember, insulin and glucagon. But it also produces the enzymes that help break down our food in the digestive tract. It's a small but mighty organ in the body. Those digestive enzymes are still present with diabetes, so they're not important to remember for now, although they have a very big job to do. We will also talk a lot about the cells in the body, and cells are essentially the smallest component of how our bodies are made up. Our skin, brain, muscles are all made up of tons of cells that create the network that build that tissue or organ. Cells are the powerhouse. Think of this like the engine of our body. They require energy or gas to do the work that they do, and they have many different functions within the body. Keep these terms in mind as you move on to the next module. See you there.